Hi Jane,
Oh, hello there.
how you going?
Oh, pretty good.
Good, my name's Corinne, I'm your student nurse and I'm here to take a health history.
Oh, okay.
Yeah, do I have your consent to do that?
Yeah, that's fine.
Yeah, it'll just take a few minutes and I'll
Okay.
ask you a few questions. Would you like me to come back when
Oh, no,
you
it's fine. Could
finish?
you just pop it up on the table for me?
Yeah, absolutely. And I'll just draw the curtains to give us a little bit of privacy.
Okay.
Awesome. Let me just check your details. Can you give me your name and date of birth?
Yeah, it's Jane, and it's the 21st of June, 1964.
Okay, awesome. And I'll just check that number, 354238. Awesome. Okay, beautiful. Thanks. Are you comfortable?
Yeah, yeah.
Fabulous. So, tell me what brought you in today, Jane.
Well, I've had some pain and tingling in my right hand.
Yeah.
And I went to the GP.
Yep.
Who referred me, and yeah, I've had a carpal tunnel release operation
Right.
today.
Okay.
So,
Oh,
yeah.
wow. And how you feel, or how was the pain before you came into the hospital out of 10?
Well, it fluctuated a bit, but it was often around probably a 6 or 7.
Oh, wow. Yeah. And how's it feeling now? Can you feel anything?
It's feeling a bit numb, but I'm not in really any pain. I think just the painkillers are doing their thing, but yeah, just feeling a bit numb.
Yeah, well, that will be because of the numbing during the surgery, and that is going to wear off over the next few hours. If you do start to experience any pain, do you know where the call bell is?
Yep.
Yep, your fingers, and they're looking nice and pink and healthy,
Mm-hmm.
so that's awesome. Okay, so a couple of other questions then. Allergies. Do you have any allergies to either medication or food?
No.
No? Okay, so then how about medications? Are you on any prescribed medications?
I'm on sertraline, 50 milligrams,
Right, okay.
Yeah.
And when did you last have that?
this morning.
This morning, okay.
Every morning.
You have it every morning, right? Okay, great. How about anything else? Over-the-counter medications or vitamins?
No.
No, okay. So even for the pain before
Oh, well,
coming in,
before
you were
coming in, I was having Voltaren
right.
to try to help with the pain.
Yep, got it.
Yeah.
Okay. And do you? How much of that were you having?
500 milligrams a couple of times a day.
A couple of times a day, and was that for a long period before you came in?
Yeah, probably at least a month or so.
Got it. Okay.
Yeah.
Jane, do you smoke?
Yes, I smoke about 5 a day.
About 5 cigarettes a day. And how long have you been smoking?
Oh, about 40 years.
Alcohol, do you drink alcohol regularly?
I don't drink at all.
You don't drink at all? Okay, awesome. Great. And then just talking about your medical history, have you had any sort of substantial illnesses or surgeries in the past?
No, this is the first time. I must have been very lucky. But this
Yeah.
is my first time at 65 to be having surgery.
Wow.
Of any kind of significance.
Yeah, right. Have you been to hospital at all before?
Yeah, I've had a broken leg from a fall,
Mm-hmm.
and just various sort of injuries, but nothing really bad that required surgery.
Okay, okay. And which leg did you break?
I broke my right leg.
Right leg. Okay. And when was that?
That was probably 20 years ago.
Okay, so around 2003?
Yeah, something like that.
Okay, awesome. So, inputs and outputs. This question's about what you've eaten and drank, as well as when you've last been to the toilet. So,
Okay.
you've literally just been having your sandwich.
Yeah.
What was the last meal you had before that?
Oh, well, I had anaesthetic with the operation, so I didn't eat anything this morning.
So you're being very patient to allow me to question you while waiting to finish your sandwich.
That's okay. That's okay.
Yeah.
Yeah. So I ate last night.
Yep. Okay. And what did you have?
I had lasagna.
Yeah. Okay. And then drinking. So you've had the coffee there. And what was the last time you drank before?
Well, I just had water this morning because that's what I was instructed to do.
God, very good. And how much water approximately does
Oh,
it?
just a glass and a half probably.
Yeah. Okay.
Yeah.
Awesome. And then how about when did you last pass urine?
Actually, not long ago. Yeah, maybe 10-15 minutes ago.
Fantastic. And did you manage to get to the bathroom by yourself?
Yeah, it was fine.
Yeah. Yeah, beautiful, because you know that we're talking about discharge this afternoon.
Oh, good.
So
Yeah.
that you're up and able to go to the bathroom is a great sign.
Yeah.
When was your last bowel movement?
Yesterday morning.
Good. Okay, great. And so thinking about what brought you to the hospital in the first place, so you spoke to me a little before about that you'd had some pain.
I went to a physiotherapist,
Right.
and it improved a little bit, but it was still a problem.
Got it. Okay, great. And then, as I said, looking to discharge this afternoon. Just want to ask and understand a little bit about who will be there to look after you when you get home, because it will be a couple of weeks before you can drive. So, do you have someone who can firstly come and get you this afternoon?
Yes, my lovely son will come and get me.
Oh, that's nice.
He's 26. Yes.
Yeah. Who are you living with at the
I
moment?
live on my own. But my son is going to stay with me for a couple of days
Fantastic.
to help out with cooking and just basic things like that until I can take care of myself. But I've also got friends who have said that they'll pop over with meals if necessary
Nice.
as well.
Yeah,
Yeah.
beautiful. Because what do you do in life outside of the hospital?
Well, I've been a business owner for many years, so yeah, self-employed.
Okay. So it sounds like you know how to manage things.
Yeah, reasonably so. I'm not daunted by it. Let's put it that way.
Yeah, good. Okay. So you feel confident that you have the support available that you'll need, or should you need it?
I think so.
Yeah, beautiful. Okay. Last question, just to complete that earlier question about illness. Is there any significant illness in your family?
There's a bit of heart-related things. So we've had it seems to afflict the men in the family more than the women.
Yeah.
But some heart problems. My father had a bypass operation.
Right. Okay.
And actually died of a heart attack.
Right.
Nothing much apart from that.
Okay. And have you? We've obviously been doing your vitals since you've been in hospital. I saw your blood pressure was just a tiny bit elevated. I wondered whether historically it has been, or might that just be a function of maybe a bit of stress?
Yeah, maybe. I don't think it's. I've ever heard that it's high.
Great.
So I think it's probably okay. Yeah.
Okay, great. So that's it for the health history assessment.
Would you like to receive some feedback?
Yes.
Okay.
So I think that in terms of what I did well, I think there was plenty of eye contact. I think that I connected with you and made you feel reasonably comfortable, and I covered most of the things that were important to cover, pretty much all of them.
Yeah, I felt that you had. I felt that you cared, and that you asked the right questions, and yeah, I've just found it very pleasant.
Excellent. And then in terms of what could have been done better, I felt I was a bit nervous. I probably talked too much, could have just got to the point. And I wondered whether I made you concerned about your blood pressure when I said that it was a little high, and I'm not sure whether I meant to do that or not.
Okay. Yeah, well, I did feel that you were a little bit nervous as well.
Then I guess for next time, I'm just straight to the point, ask the question because I'm going to be time limited in the hospital. I think the nervousness is just a time thing. And particularly the nervousness around asking intimate questions about people's bodies and bodily functions. I think I'll get used to that. So maybe I just can do a bit of practicing.
You come and check on me.
Yes. Okay. So I'll practice with you. Is that?
Yeah.
Okay.
Fine.
Fantastic. Thank you.
Thanks.
So, is there anything, just I'll leave now, is there anything that you need that I can
No, I've got
help
my
you
coffee and I've got my sandwich.
Beautiful.
So I'm happy.
with? Okay, and you've got the call bell
I do.
as that numbness
Yeah.
wears off.
Yeah.
Awesome. Thanks,
Thank you.
Thank you very much. Bye.
Bye.